everyone, welcome to OET 369. I hope you're all doing very well. Okay, so we are going to discuss about a particular writing topic today. So before we go to the video, I would like to answer you. Yes, we do have online coaching available for OET, CBT, IELTS, OSCE, everything. So if you would like the details, please log on to our website english369.uk, or you can WhatsApp me. I have included my WhatsApp number with the description. Let's now go to today's topic. Okay, I think the major problem that OET aspirants or OET candidates face in their writing task is they don't know whom they are writing to. I mean, they know whom they are writing to, but they have no idea. Or sometimes OET may ask you to write to an unknown profession or unexpected profession probably. We usually write to doctors, we usually write to nurses, physiotherapists, but how about a speech and language therapist? How about any other therapist? Like recently they've asked about musical therapist. And most of my candidates told me they have no idea about this. And they did struggle during the exam time. Okay, so we have planned to upload different professions that you may have to deal with in actual nursing in UK or Ireland. So we have created a video series on that one actually. So the first one, that is today, we are going to deal with writing a letter to a speech and language therapist. Okay, so the first thing you are going to look in your writing task is, who am I actually writing to? Oh, a speech and language therapist is really weird because I have never done it before. You may think like that and you may struggle. So let's listen to this, have an idea about the role of a speech and language therapist, and then we will go to our writing task. Okay, so speech and language therapist, in short we also call SALT, is a healthcare professional who look at the patient's swallowing and speech functions basically. So they do look at a patient's speech problems if they have any speech problems, but majorly the nurses refer in this country about the swallowing problems. If they are at risk of aspiration, if they had a recent choking episode, if you are concerned about their swallowing, we may have to refer our patients to speech and language therapist. Okay, so the speech and language therapist will then come to the patient or will then assess the patient, and then they are the ones who determine actually what is the next plan for the patient in relation to their food intake. Okay, they can also look at the swallowing difficulties, but most probably we don't do it here. Usually the doctors do it, not the nurse's job really. Okay, so let's take a case note today. This case note is created by me only, so don't expect like a very professional case note. It is just to give you only a little layout and you know what exactly to do if you are asked a question like this. Okay, so let's go to the writing task. Okay, so let's read the writing task. So write a letter to a speech and language therapist explaining the situation, requesting an urgent evaluation. Okay, so we now know that we are writing to a speech and language therapist. We think that this is an unknown case. The speech and language therapist may not know the patient in this case, but we can re-refer to them so they may know the patient. There are cases like that, but today we will consider this as an unknown case. Now we need to request an urgent evaluation. So note the point, and in the introduction try and mention this, that this is something needs attention really. Okay, we will now go to the case note. So we have identified who are we writing to, whether it's a known case, and what sort of intervention that you're asking for. Now let us go to the case note. Patient details. So patient name is given, date of birth is given, date of admission is given, social background, he's a widower, has got 2 sons, what is his eating preference, he lives alone. Medical background, he's got some medical problems which we have listed out. Okay, so that is the first part of the case note. Moving forward, we've got admission details. So we've got the presenting complaints. So it says off legs, decreased mobility, confusion, urinary tract infection, cough, and then the diagnosis. And then we've also given about the recent nursing notes. Okay. And finally, we have got the plan. This is how the case note looks like. Let's go back to the first card where we got the patient details. So obviously we will include the patient's name, as you all know. Try and include, when you tell the name, first thing in the paragraph, try and include their names rather than saying he or she. Use the noun itself. Date of birth is given. So you could probably put that in your reference. Date of admission is given, which you may have to say. Social background. Actually, will you include any social background when you write to a speech and language therapist? He is a bit over 2 cents. I don't think that is relevant to a speech and language therapist for an urgent assessment. I wouldn't bother saying that. He prefers to eat pies, chips. Okay, both mentioning that because then we know that what his preferences are. So we could actually, even if he goes to a modified diet, we could actually look into these preferences and the speech and language therapist can decide what are the types of modified diet he or she can have. So I may include that, but remember, you may not have to say it in the first instance. Leaves alone, not relevant, just ignore it. Medical background, stroke in 2007 and now it's 2021. You will probably say about the stroke because stroke can cause swallowing dysfunctions and it is a long-term complication of a stroke. So you may have to include that. Constipation occasionally, I don't think it is that relevant. No teeth, he has dentures. You may have to include this because if he has dentures, if he has got any problems with his dentures, the speech and language therapist should assess the patient by feeding them. So it is worthy to know that this person has dentures. So I may try and include that in my letter. Again, that is only a supporting information. So you can probably say that towards the end. Asthma, not really relevant. Now, I hope this is clear. So we have selected what are the case notes. So we've got some points that may benefit the speech and language therapist to know or that would be beneficial for them to know. So I wouldn't include this in the first instance. Okay. Now, this is an urgent assessment, so I'll probably have to speak about admission details, presenting complaints in the first place because that is what made this referral urgent. Okay, so presenting complaints, off legs, decreased mobility, confusion, UTA and cough occasionally. Please remember, it is quite common for you to state all these complaints as it is. I don't think this is necessary. Decreased mobility, he or she is not going to do, or speech and language therapist is not going to assist with their mobility, so just ignore that. Confusion, yes, it is worth including because it is better to know that this patient is confused so they can deal with it. UTIs, you can ignore that. Occasional cough, very important information, I will include that. And I will also include the diagnosis, which is pneumonia. There are chances of aspiration in this particular diagnosis, so you must say it. Try and include that in the introduction itself and try and include your main complaints at least in the first paragraph itself. Now, recent nursing notes. Definitely say this first because this is what made my referral urgent. So it says 29th of the 1st 21, he was admitted with chest infection. So I will say that he was admitted with chest infection and was stabilized after IV antibiotics and currently he is on oral antibiotics look like it. I think he was commenced on oral antibiotics already. So you can say that. You may have to concise this information. You don't have to give a detailed explanation of this, but you still have to say that he is still on antibiotics. That is probably worth. Now, 11th of the 1st 2021, we noted shortness of breath, decreased saturation, increased respiratory rate, and cough on drinking, declined smears, he is agitated and he is restless. I would include all the information as it is because this should help a speech and language therapist to determine what is their exact problem. So shortness of breath, yes, you may have to say. Respiratory rate stats may not be in details. You can just say that he was noted with shortness of breath and maybe with breathing difficulty. You definitely have to mention again the cough. We still notice cough while he drinks and he declines smells. So his actual intake is very low. So it is worthy for them to know because they can then decide whether he needs some finger foods or anything like that, or whether they need to consider the preferences. Or they need to another referral to dietitian to consider any supplements. So all these things can be included, which I will probably include in my letter. Okay, so we have included all that. Now the plan. We should say the plan. You can either relate with your recent nursing note. So you can say that because he was coughing while drinking, we kept him nil by mouth. Or you can even say that he's nil by mouth. That is very important information for speech and language therapists because they are the ones who decide whether actually the patient needs to be fed or not. Start IV fluids and switch to IV antibiotics. So here IV antibiotics is something we don't have to say, but you may have to say that the patient is on IV fluids. So then the speech and language therapist can decide what kind of nutrition they have. They have parenteral nutrition, so it's worthy for them to know. Collateral history, I wouldn't probably bother saying that. salt referral, which we are doing now. So please don't ask them to refer to salt again. This is a common mistake I have identified. So please don't do that, because that's what we are doing now. Referral to gastro department. Yes, worthy saying. You can just say it is worthy to know that he has also been referred to the gastrology team or something like that. Dietitian referral, as I've explained already. Weight loss noted. So it is worthy for the speech and language therapist to know that we have done a dietitian referral for that case. Okay, so I think this is what a speech and language therapist does, and this, for their job, this is what they need to know. It's quite easy now. I know what exactly to include in my letter. So as usual, you can start a letter. You can write the presenting complaints and the major problems the patient has, and then you can also say the relevant background information in the next paragraph, which may be worthy for the speech and language therapist, and end up with the plan. You can also correlate the recent nursing notes with the plan. If you want to do that, you're absolutely fine. You can do that way. You wouldn't have to include any social history unless the speech and language therapist deals with the family. If they have to deal with the family, if they have to support them at home after discharge, yes, in that case I may include the social history. Okay. So I hope this video was useful to all of you. So next time when you get a speech and language therapist letter, please remember these points and make out. I know it's really hard for you guys to formulate a letter if you're not sure about the medical professional that may come across in the question, but remember, we're here to help you. I will come back with different healthcare professionals that we may have to write from my years of experience in UK, and if that is a great help to you, I'm more than happy to help you out in this case. Alright, so thank you so much for all your support. I've been getting many positive comments, and that makes me, prompted to do videos even if I don't have enough time, but I will try and come back with more videos. Definitely, we can expect more live videos and more live sessions in our YouTube channel as well as in our FB page OET369. So please do subscribe and please do support us. I hope you are preparing well for your exams. Exams are nearby, so please prepare well, and I will see you all shortly. Thank you. Bye-bye.